It's time now for the all-new Animal Health Forum, brought to you by Paws Dog Training and Canine Behavior Center and Lake Chatoog Animal Hospital. And now your hosts, Ed Abel and Dr. Hilty Burr.
Well, hi, everybody. We're so happy that you're with us today. Of course, myself and Dr. Burr, we want to answer your questions.
Hey, Ed.
We want to find out about dogs. Doc, how you doing?
I'm doing good. Good. Yeah, let's get this going as far as questions that folks can. I know they can reach us by email at animalhealthforum@gmail.com. And let's see, how about the other ways they can reach us, Ed?
They can go online and they can go to www.pawsworkingdogs.org or send any questions you might have to ed@pawsworking.org. Our phone number is 706-716-9990. Let me give you that phone number again, 706-716-9990.
Now, I know you're busy a lot. Can they leave a message on that phone?
Absolutely. The message will get back to you. Good. But I'd also like to mention a couple of our sponsors that are helping us out here with the show. And one is, I think you might be familiar with this group. You might have heard of them before, Lake Chatoog Animal Hospital.
Yep. In addition to your company, Lake Chatoog Animal Hospital has been a sponsor for years, and they're continuing their sponsorship. And I'm very grateful for that. Cheyenne Spagola is the hospital manager. She values this show because our whole goal is one of our main emphasis is just to educate the listeners on proper pet care and animal health issues. And they've got a great hospital, I think, and they've grown. Dr. Will Patterson is the managing vet now, younger veterinarian. Dr. Marshall's still there. So I've retired. I still interact with them from time to time, and I've offered myself for relief if they ever need any help. But I'm mainly focused on your nonprofit and, of course, the Celebration of Pets Foundation. But the other sponsors, of course, is the folks you met in Blairsville.
Blairsville General Supply. They're located on the Gainesville Highway, just outside of Blairsville, and it's where we get our From dog food. We highly recommend From dog food. But the store itself is very unique. It's a kind of a garden center and farm supply, pet foods, as well as a really neat little boutique that they have. And it's father-son operation, and they've just got a great group of people over there. And please, if you do go in there, let them know that you heard about them from the radio show. We would appreciate that.
Yeah, and I know folks have questions about their pets. Sometimes they'll notice something, but they don't think it's anything they need to worry about. But, if y'all want to contact us with any question, either about your pet health care or behavior issues. Did we get any questions for you this week, Ed?
Yeah, I do. I have some more questions, which we're really excited about the questions that we get.
Okay, which one did you get?
Okay, I've got one. It's from Ralph from Murphy, North Carolina. Mm-hmm. And this pertains to, he has 2 dogs, and he said recently these dogs have started showing aggression to each other. So we want to go a little bit further, because when dogs are showing aggression, we want to find out what type of aggression we're talking about. Is the aggression play aggression? Is the aggression food aggression? Is it possessiveness? That helps us a lot. So one of the things that we ask people is to look at their dog, watch their dog. Is the dog giving you any indicator of what's coming before a fight with another dog? The other thing, too, a lot of times people are very quick to jump in when 2 dogs might be sniffing each other or there's a little grumbling going on. And what we tell people is you have to let your dogs kind of work it out. Sometimes the humans precipitate the involvement and they cause the fight. So understanding the level and the type of aggression. The simple answer to the question is yes. Dogs that show aggression to one another that have gotten along, it's a situation that can be corrected. Versus a dog that is a true dog fighter that doesn't care if it's a male or female, spay or neuter. It's just going to go and attack another dog. Very, very different.
Oh yeah, that's a great question. And when you were given the answer, which I thought was a really good answer, that happens all the time. And the main thing that I noticed when you said be patient and just make sure they're just not getting to know each other, and when they do jump in, sometimes that actually creates the hostility.
Sure, and dogs have a pecking order. Dogs are a pack animal. This is one of the things we discuss a lot in our training program, is how pack behavior influence the training and the behaviors with the dog. So understanding pack behavior is very, very important.
Yeah, that's really great, Ed. I've got a question here, but this one's not about dogs, though. It's about cats. And again, I want to emphasize that any question, any species is fine. I did do large animal work a few years back, but I did it 12 years. And, if I have a motto: if we don't know the question answer, we'll find out. So ask us anything, as I like challenges. Here's one, Ed, from Jim from Young Harris. Says, I have a 10-year-old spayed Siamese cat that vomits up her food about once a week. She seems fine otherwise. Is this normal? No, if it's once a week, that's not normal. I'd be concerned. Just like people, pets, cats and dogs, and especially, or any pet really, could have occasional vomiting that may be from they ate too fast, or maybe they got too much activity after they ate, or maybe they ate something that was upsetting. And if it's just, I have a rule of thumb: if they vomit more than once a month, then that's probably something you need to pursue to see what's causing it. There's all kinds of things that can cause a cat to vomit. It can be something like hairballs. It can be other obstructive problems. It can be a health problem related to the major organs, for example, kidney, liver. It could be an endocrine disease. Then there's really no magic wand. I did have someone say, well, if I don't want to take my pet to the vet, what should I do? And I said, well, you can try getting a hairball remedy and at least eliminate that possibility, or sometimes parasites, and you could try giving a dewormer. But if you try some simple measures like that and you're not getting any results, you definitely need to seek out your veterinarian, because they can do some testing, and that would involve some blood testing, maybe some testing of imaging and this kind of thing. But as a rule of thumb, any more than once a month, then I would be concerned. Okay, so those are our questions this week. And do you have any events coming up, Ed, that we need to be thinking about?
Yeah, we're talking about the pet celebration that's going to be coming up. There's a concert, I believe, that you have scheduled, and the mayor's auction.
Oh, yeah, I'll talk about that for sure. Yeah, that's coming up they say that's March 15th is the annual Hayesville Mayor's yard sale and community day, and we're really excited about that because Celebration of Pet Foundations is setting up a booth, and we have lots and lots of items. And, I forgot to mention the last time we did this last week, where I'm going to be there all day, so it's kind of be an Ask the Vet opportunity as well. And it's a fundraiser for us. And then I am looking forward to the event with that we're working out with the E212 Entertainment, and we'll tell you more information about that. The other couple of things I just want to remind everybody of is on August 27th, we have the Howling on the Square, which is our first annual pet celebration concert with Gnarly Fingers. It's sponsored by United Community Bank and Lake Chautauqua Animal Hospital, and I'm sure there's going to be a big crowd. Everybody loves Gnarly Fingers, and we'll be asking for a benefit fundraiser for us. So please come out, bring your pets. That's the main thing that's unique about that event is that your pets are. That we have the saying, pets can come and you can bring, and the pets can bring you along if they want to. So bring you on a leash.
Hey, Doc, I want to talk about something related to what you were talking about in the question with the health issues.
Yeah.
A lot of times we'll have people come to us and they're experiencing behavior problems. And from what I understand, Lake Chautauqua Animal Hospital has a new groomer.
Yes, sure do.
And believe it or not, we have seen dogs lately where people decide to do their own grooming. So that what they do is they start cutting hair around the eyes. And all of a sudden they come back to us and say, my dog's always loved kids, has always been very friendly, and is now showing aggression. When they bring the dog to us, we'll ask them, have you cut the hair around the dog's eyes? And they'll say, yes, we've done that. People need to understand there are certain breeds, and the reason that hair is covering their eyes is it helps with their depth perception. When you cut that hair, if you put a hand going down to that dog, that hand looks 5 times the size that's coming down, and it scares the dog, and the dog becomes aggressive. That hair is there for a purpose. So what we always tell people, first thing you want to do if you're having some behavior problems is to look at health. An animal that is discomfort or experiencing discomfort or is having other problems. So you want to start out with the veterinarian to find out. The second is talk to your groomer. A good groomer is going to know what you should and shouldn't do. Comes to another issue, shaving of dogs. We're coming into the warm weather. People will shave their dogs down. What they don't understand, especially breeds like German Shepherds, it's one of our favorite. that double coat has a purpose. It insulates the dogs. So in the wintertime, it provides a level of warmth. In the summertime, it provides a level of coolness for the dog. When you start shaving dogs down, you could actually make your dog more prone to things like sunburn, sunstroke. So before you do that, always think of what the outcome would be and talk with an expert before you take any action in grooming your dog. Again, if you see your dogs behaving differently, look at possible medical issues. Doc, you just helped us with one of our boys, little Dino. Dino's a Boer Bull, a South African Mastiff. And he was experiencing some stiffness and wasn't moving quite right. Can't speak today. Quite right. And so Dr. Burr checked him over, and sure enough, we kind of thought, you know the term. We
panosteitis.
We call it pano, but there's a medical term for it. Yeah. And Doc put him on an inset, and it worked. And we took him off. He's been off now for 4 days.
Oh, good.
And he's running around, and he's moving around really well. So, rather than us trying to think of, did we do something or, limit him from doing any movement, your advice was spot on. So I always tell people, call your veterinarian, go to your veterinarian if you're seeing something different in your dog, because a lot of times you can nip something in the bud early, save yourself a lot of aggravation, time, money, and pain for your dog.
Right. Yeah. Early interventions always gives you the best outcome. Well, we better take a break now. So again, we'll be back, and we'll have another half of the show, and we may have. We got covered our questions, but we've got some more things we want to fill you in on.
Welcome back to the Animal Health Forum. Once again, your hosts, Ed Abel and Dr. Hilty Burr.
Okay, it's my time, Ed. I'll take the intro. Welcome, everybody. It's our new and improved Animal Health Forum show. I'm so happy to have Ed with me. Takes the pressure off me a little bit. Hey, Ed, I think folks, I'm very, as you know, I'm president of your board for the medical service dogs, and you have done a great, you've done a great job of kind of defining what your objectives are. Would you mind going over the three kind of arms of your nonprofit?
Sure. Paws Working Dog Support Network is a 501c3. We're a nonprofit organization. We have three primary missions. Provide fully trained special detection dogs, canines, to law enforcement and first responder agencies. These include dogs that can be trained in drug detection, explosive detection, firearm detection, search and rescue, tracking, and cadaver detection. The second phase is provide specially trained service dogs that can assist people with physical and or emotional disabilities. PAWS emphasis is placed on disabled veterans and children in need. These dogs and their training are provided at no cost to the recipients. And the third facet, or the third prong to our program, is conduct training courses and seminars for current and future trainers to ensure the highest degree of professionalism and consistency in maintaining training standards. One of the things that we were just discussing this the other day about the training standards. We want to raise the bar. If you're going to serve in this profession as a trainer, as an instructor, it's very important that you understand all the aspects of it. It isn't just about the dog. It's also understanding why and how a dog learns and why and how people learn, because our job is education. That's our first and foremost, is educating the general public. Over 62% of dogs that end up in animal shelters are there because of behavior issues.
Right.
And that's a lot of those dogs could be spared being rehomed or put in shelters if people put them through a training program. Now, our PAWS Working Dog Support Network, as you know, we are seeing a large number of people, young adults and children with autism.
Yeah. And
we had Rebecca on an earlier show. She's a young gal who's going to be working with us. Her expertise is in dealing with autism.
She's been working with people for quite a few years.
Right, and she also has a dog background. Yes, she still does that. She's in the field working. And so bringing her on is going to be an added plus for us, because when you see the number of cases of autism, and when we're dealing with autism, we're dealing with very highly functional individuals all the way to nonverbal, very limited in their capacity.
Is that their main problem, interaction? Is that
A lot of it is interaction, over stimulation, and then closing down. And this is a big facet where the dogs come in, because the dogs can help someone calm down. We know, just as pet owners, how watching television and stroking our dog, how it makes us feel. And we all know the reports that have been put out in the documentaries on how dogs help lower and reduce blood pressure, relieve stress and anxiety. Well, for people that are suffering from autism or other disabilities, their stress levels are much higher, and we can get the dogs to help bring that down. And so it's very advantageous to put. Now, I always caution people, because dogs aren't the answer for everyone. We have to make sure, and that's where having Rebecca on board really comes in, because, as you know, Hudson's been working with me a lot and doing a lot on the behavior side, but we're dog trainers. Now we have somebody who's giving us input directly to relationship with autism. So we're really excited about doing this work.
Good. So she'll be kind of specialized in that area then.
Correct.
Right. Good. Because, like you said, I don't know the statistics, but like you said from the beginning, it's really a common problem, particularly in children.
Yes.
You mentioned young adults. Is that fairly common as well?
Yeah, you know, it's I'm being educated on this as well, and what we're learning is a lot of things that were classified years ago as maybe mental retardation or learning disabilities or socially emotionally maladjusted children are actually autism.
So they were misdiagnosed, probably.
Kind of, and the treatments sometimes were misrepresented. So now, you know, when the first step, I want to cover this because people that might know someone who could benefit from a service dog, the first thing that we do is we ask for a letter from the family practitioner, the family physician, or the specialist that they feel the dog would be a help to this person. That's our first step. Then we bring it to the board. The board then says, yes, we think this would be someone that could benefit and we want to move forward with it. Then we do an interview, and during the interview process, we try to gear to what type of dog, what would be best suited, and so on.
And so, or if they have a dog, see if it's suitable.
Yeah, and we try to get people not to get dogs. Getting a puppy thinking this will be my child's service dog, whether it's for autism, diabetes, mobility, that really puts us behind an 8 ball because most of these dogs will not qualify to be trained as service dogs.
But you'll evaluate if that
We would absolutely evaluate, and we have several. Dex, our little diabetes dog, he was their puppy. They raised him up. We did the obedience, as a matter of fact, through Paws Dog Training and Canine Behavior Center. So that is, one of those cases. But I think if you were to talk to someone like Dan, who has Moose came from our training program, we can eliminate a lot of the pitfalls or obstacles.
That's right, because you do have since you've been in the field so long, you have a good way of sourcing pets. And that and you can talk to that, but that's another thing I want to mention before you do, is that's one reason why I think we want to really interact with the local rescues. Kind of elaborate on that, because I don't think it's as breed specific as people think it is.
No, not at all. As a matter of fact, we really depend on a lot of the rescues and Humane Society and things like that, because they get some really good dogs with, behavior issues that are not as big as everyone thinks that they are. Or, people, from your years working in vet clinic, people go through divorces or they have to move or relocate, and especially
just life gets in the way somehow. Yeah.
Sure, and they'll turn their dog to a rescue, and we will definitely evaluate. So any of the rescue organizations, if you think you have a dog that would be suited as a search and rescue dog, a service dog, a medical dog, please get a hold of us, because we would certainly like to take a look at them.
Yeah, that's great, because that to me serves. You have two needs. You have pets that need a home, and that you need pets to help people who have medical needs. So it's such a perfect fit.
Sure, it's a win-win, and we're all about creating win-win-win situations whenever possible.
Yeah, so that's really good. All righty. I do need to mention a couple of things that Lake Chautauqua wanted me to mention, which is very appropriate because they're always thinking of things in seasonal perspective. Don't forget, heartworms is still a common problem. Be sure to have your pet on heartworm preventive. While we're talking about rescues, I had a conversation with Valley River Humane Society manager Kirsty Waller, and she's a wonderful manager, by the way, out at Valley River. And she was having 17 pets they were treating for heartworms at one time. So that kind of goes to show that's kind of a objective information that heartworms is definitely prevalent. And when I was in practice, I saw a lot of pets that were on preventive, but when I did see one that wasn't, a lot of times they did turn up positive. So prevention really, really is important. And I guess the other, we should mention the company in Blairsville that helps sponsor us, Blairsville General Supply. We really appreciate that. And of course, Ed, your company helps with the show as well. And don't forget, we want to hear from y'all. We got some good questions this week, and keep those questions coming. And Ed, if you want to remind everybody, it's animalhealthforum@gmail.com, and then you're willing to give out some phone numbers, I think.
Sure. They can get a hold of us at 706-716-9990 or 1-888-840-3647 or dogs. You can also find us online at pawsworkingdogs.org. We also, we were talking about preventive flea prevention, tick prevention. Please go head over to Blairsville Supply because they have all of the products you need to treat your yard and the grounds where these dogs are picking up these parasites.
Yeah, that's a great idea. And we really appreciate everybody listening. And, this show is about you. And be sure to tune in next week. Have a great week.